Newcastle disease is an infection of domestic poultry and other bird species with virulent Newcastle disease virus (NDV). It is a worldwide problem that presents primarily as an acute respiratory disease, but depression, nervous manifestations, or diarrhea may be the predominant clinical form. Severity depends on the virulence of the infecting virus and host susceptibility. Occurrence of the disease is reportable and may result in trade restrictions. Infected birds shed virus in exhaled air, respiratory discharges, and feces. Virus is shed during incubation, during the clinical stage, and for a varying but limited period during convalescence. Virus may also be present in eggs laid during clinical disease and in all parts of the carcass during acute VNDV infections. Chickens are readily infected by aerosols and by ingesting contaminated water or food. Infected chickens and other domestic and wild birds may be sources of NDV. Movement of infected birds and transfer of virus, especially in infective feces, by the movement of people and contaminated equipment or litter are the main methods of virus spread between poultry flocks. Clinical findings. Observed signs depend on whether the infecting virus has a predilection for respiratory, digestive, or nervous systems. Respiratory signs of gasping, coughing, sneezing, and rales predominate in infections with NDV. Nervous signs of tremors, paralyzed wings and legs, twisted necks, circling, clonic spasms, and complete paralysis may accompany, but usually follow, the respiratory signs in neurotropic velogenic disease. Nervous signs with diarrhea are typical in pigeons, and nervous signs are frequently seen in cormorants and exotic bird species. Respiratory signs with depression, watery greenish diarrhea, and swelling of the tissues of the head and neck are typical of the most virulent form of the disease, PM lesions. Remarkable gross lesions are usually seen only with viscerotropic velogenic Newcastle disease. Peachii may be seen on the serous membranes. Hemorrhages of the proventricular mucosa and intestinal serosa are accompanied by multifocal, necrotic hemorrhagic areas on the mucosal surface of the intestine, especially at lymphoid foci such as cecal tonsils. Splenic necrosis and hemorrhage and edema around the thymus may also be seen. In contrast, lesions in birds infected with NDV strains may be limited to congestion and mucoid exudates seen in the respiratory tract with opacity and thickening of the air sacs. Secondary bacterial infections increase the severity of respiratory lesions.